Welcome back to Open Line, everyone. We have with us Dr. David Aronoff. He is director of the Division of Infectious Diseases at Vanderbilt University Medical Center. He's joining us via Zoom and a bunch of calls. He's here to take your questions about this new variant, booster shots, COVID in general. And so let's go to the phones. Let's go to Paul. Hello, Paul.
Yes.
Go right ahead.
Thanks. I think the public out here is getting a little bit confused because there's so much different information on TV. A few days ago, the president got out. He had the vice president and Dr. Fauci there, and they talked about this variant's coming in from South Africa, and that it would be a couple of weeks before we found out whether it hit the United States or not. Well, they showed a map, and it showed it all in Canada, but nothing in the United States. Yes, so today, they, on one of the major news channels, they confirmed that the first case, or at least reported first cases, in San Francisco, California, that the person had just recently been to South Africa, and it came back, and that felt bad, and he reported it to his doctor, and that they have already treated him, and he has recovered from the virus. And he had both of his shots prior to going to South Africa. So it seems like the messages coming from the different networks and the messages coming out of Washington, D.C. are not the same messages, because at Washington, D.C., in my listening to it, was going to indicate it was maybe as much as 2 weeks before we knew how effective the vaccines were on this variant. So,
okay. All right, let's talk about that. I appreciate your question. There's confusion. I think your question can be answered. He's saying he's a little frustrated that there's all this different information. The president said it's going to be a couple weeks. You said at the top of the show it's going to be a little bit of time before we know a few things about this variant. But let me let you answer what he's saying there.
Yeah. First of all, let me say thank you to Paul, because he's hit on a really important set of issues. One of which is that it is really difficult to make predictions about how quickly we're going to find virus strains around the world. Once we start looking for them, sometimes we get surprised that they're already there. And so, yes, indeed, we have found a patient with the Omicron variant in California. That was a fully vaccinated person who had relatively mild illness. Now, we can't really extrapolate a lot from that single experience to know how well our vaccines are doing to protect against symptoms with that Omicron variant. Because remember, the majority of people who get infected with SARS-CoV-2, regardless of the variant, have a very mild course or are asymptomatic. And that's even unvaccinated people. Most unvaccinated people will either be asymptomatic or mildly symptomatic. The problem is that there's a significant fraction of unvaccinated people who will end up getting seriously hurt by SARS-CoV-2 or end up in the hospital or end up dying. And the vaccines thus far have been protecting against those outcomes. But when you just take one person who's fully vaccinated and gets a mild case of COVID from Omicron, it's hard to know, is that because they were vaccinated or not? We hope it is. We certainly hope that that's the case, but it's just really tough. So what we need to see is a population study where we can look at hundreds of people, for example, who have COVID, some of whom are vaccinated and some of whom are not, but all of them have Omicron, and see if there really are differences in the severity of illness between the group of people who were vaccinated and the group of people who were not. But Paul, you raise a really important issue. And I think one of the most important ones is that at a time of crisis in a pandemic, when lots of things are changing in real time, it can really be possible to get mixed messages, and it can be hard to make predictions. And that's why it can take just time to get the full story. And that's why I'm really happy you're engaged tonight, because that shows to me that you're looking for different sources of information to see sort of where things sit right now.
I think experts have been saying it's going to take about 2 weeks for us to know if this does kind of evade the vaccine, and a lot of things, how severe it is. It's going to take a couple of weeks. I don't think anybody was thinking that this would miss the United States. I mean, it was already in Canada, as Paul said. It was in a bunch of countries. I don't think people were thinking, wow, we may miss this. This is going to come here.
Yeah, that's exactly right. I think you made a really good point, and I think many of us, when we saw that this had been found already in over 12 countries very recently, we all thought, oh wow, it's going to be very quick when people start to realize that this has disseminated a lot. Remember, the reason we're in this pandemic is that this virus has gotten in front of us the whole time. It spreads a lot silently. People without any symptoms at all can be extremely contagious. And so we can't just look at people with the sniffles and say that's where the virus is. And so the whole tale of the tape since December of 2019 has been, oh, wow, look how far this virus has gone right under our nose.
Very interesting. Okay, let's go to Granger. Hello, Granger.
Hello, how are you this evening? Listen, I'm a 74-year-old resident of Davidson County, and I think the coalition of Vandy, Meharry, the health department, and all the groups that got together to lead us through the pandemic to this point have done a wonderful job, probably the best in the state. At the same time, I think our state government, I think we tend to be towards the bottom of the barrel with our decision making. We're, I think the third worst state in the union on one metric recently. I asked the doctor of you guys that lead this effort and try to keep us safe, how concerned are you with the governor and the recent passage of the bill that limits the control we have locally, where the governor will decide when we wear masks, and you guys who are the experts, we know our politicians know much more about epidemics and things like that than you doctors. So could you comment on how you guys feel about that and how scared you are that you don't have control anymore?
Okay, he's talking about a special session, change the law. What do you think about that?
Well, first of all, Granger, thank you for bringing that up. I think the public health response to this pandemic has been really interesting to watch, and we're learning a lot. And we've learned a lot about just how stressed our public health infrastructure has been, and in many respects under-resourced to really handle a global pandemic in the United States. I think that local public health departments should be able to very quickly react and try to get in front of health crises that could adversely affect the health of people in their immediate communities. We know for sure that doing things like social distancing, wearing masks indoors, and getting vaccinated are protective in a time of a global pandemic that has harmed not only people, but also our economy. And when we put restraints on the ability of the public health service to protect us, then we're doing things like, for example, telling the fire department that they really shouldn't respond to blazes until they've hit the second floor. Or, we're telling lifeguards, don't throw your life-saving ring out into the water, or don't go out into the water to save someone until you can't see their hands anymore. These kind of policies that are really making it difficult to respond in real time are not particularly helpful. And so, I'm hopeful that we continue to have discussions about the way that public health can play an important role in protecting and saving lives. I can tell you the people that go into public health don't do it for any other reason than wanting to help keep the public healthy, and giving them the ability to do that and allowing them to follow science and create knowledge that helps us is really important. There
was one doctor I heard speak who was very concerned about the next time there is a pandemic and what those new laws might mean for trying to respond to it. But okay, well, thank you. Thank you for that answer. Thank you, Granger, for that question. All right, Barry and Ed, hold on the line. Others, hold on the line. You are up next, Barry and Ed. We will take a break, come back, take more calls. Be back right after this.